Analytical critical thinking. Yay! That's you guys. Right? Right. Right. Okay. Arterial blood gases. pH 7.43. Is that good or bad? Good. Because I've got the normal range right there. Not too much analytical, right? Okay, 7.35, 7.5. You need to remember that, guys. That's your normal. PaO2, 90. Is that good? Yes, because it's 80 to 100. Okay. PaCO2, 43. Is that good? Okay, so this person doesn't have any problems, right? Okay. Now let's look, and this is an obese person. Now let's look at PFT. What does PFT stand for?
Pulmonary lung function test.
Okay, we put an extra letter there. Pulmonary function test. Very good. Pulmonary function test. Vital capacity. Vital capacity is how much I can exhale after I've taken in a full inspiration. Look at this person. 4,000. Why?
Because the obesity is causing
Abdominal fat is occupying lung space in a way. Not technically, but just by having a smaller thoracic space. Total lung capacity. Everything that we have in our lungs when we breathe in. Look at how much less it is. Look at how much less it is. Expiratory reserve volume after we exhale, what's left? 1,000, barely. Because we didn't have enough to be able to have our total capacity. Okay? Medications that are used for obesity, they are on page 591 and 592. Appetite suppressants. One of the big ones is Meridia, but the FDA no longer recommends it. Why? Cardiac issues, complications. Your book also talks about amphetamines, non-amphetamines, and antidepressants. Please know that amphetamines are very dangerous and they are not recommended for weight loss, although I know that people do use them for that. What would be a nursing precaution if you knew somebody was using amphetamines for whatever reason? What would be your first thought to your brain? The heart. What does it do to the heart? How? Increase heart rate. Increase heart rate. So it's working harder. Increase demand on the heart, right? And that also increases your blood pressure. Okay. Non-amphetamines, they tend to do exactly the same thing, but they're of a different category. And then antidepressants, because what was one of the risk factors for obesity? Depression, psychosocial. So these are also used, and they speed you up too. Antidepressants speed you up. Lipase inhibitor, your book primarily talks about, what's the one that your book talks about? Say it again. Olestra. Which is basically, it inhibits lipase. What are lipases? Fat enzymes. There you go. That break down and absorb fat, so we have less absorption on our dietary fat. It acts primarily in the GI tract. That's the good news. So it doesn't act all over our body. So it's more concentrated. It also decreases blood glucose, LDL, cholesterol, and BP. So they're actually pretty good. But they have some side effects. Side effects that are not that crazy. I'll get to that down here. Up here, nursing responsibility. Administer with meals or up to 1 hour after meals. Because it acts on lipases that break down fat. The patient may need to be provided with fat-soluble vitamins, and you have to separate the administration of the vitamins with the lipase inhibitor by at least 2 hours, which makes sense, right? And this is the bad thing that a lot of people don't like. GI side effects, oily or fat stools, flatulent, because you're getting rid of that fat. Oily discharge, who wants to be having oily discharge? Frequent stools, and difficulty controlling defecation. In other words, they seep stool. So a lot of people don't like them, and that's understandable. You don't want to be walking around seeping stool, right? So patients need to know this. They need to know this. You need to know meds should not replace diet and exercise. Used in What's the word I'm looking for? In conjunction. In conjunction, but not replace. Not replace. So, for general weight loss, now I wanted to point this out to you. This is a percentage of population with a body mass index over 30. Over 30 means they are obese. Obese. 25 to 30 is overweight. Or greater than 30, obese. Look at where we are. That's the United States, right here. We are the highest. Okay? So what are we going to do to change this graph? We're going to educate our patients. What are we going to educate them? Number one, diet. It is advisable that you lose 1 pound in a week. 1 to 2 pounds is recommended. More than that is not considered healthy. 1 to 2 pounds. How do we do that? Reduce our intake of calories, 500 daily, for up to 7 days. And it takes work, guys. You have to sit there and count them. I know, because I do. So you have to sit there and count them. But it's the healthy thing to do. Exercise. If you increase physical exercise, you increase physical fitness. Self-explanatory, right? You can only walk 1 block and you get short of breath. Then later you can walk 2 blocks before you get short of breath. Then later you can walk 3 blocks. Increase physical fitness. Increases self-esteem. When you start walking more and more, lifting more weights, swimming more, bicycling more, you feel better about yourself, which cuts down one of the risk factors, which was depression, psychosocial. Good job. And decreases appetite. Because half of the reason that we eat a lot is because we're hungry, and it's there. It's there. Okay, how do we know to exercise? You always want your patient to be cleared by your physician. Okay? You don't want to start somebody with cardiac problems, going up Trans Mountain. You want to clear them from your physician. And you want to use target heart rate, which is calculated as 220 minus your age in years. Because what I can do before I reach my target heart rate is going to be so different from what you guys can do. Okay? And the recommendation, like I said, lose 1 to 2 pounds per week and behavior modification. Many people, maybe some of you guys right here, have lost weight. But then what? Regain it. Regain it. It requires behavior modification to keep it off. This is not a diet so that you can go celebrate and binge eat. This is a lifestyle change for the rest of our lives. Surgical treatments. Well, some people are candidates. Look at the difference because this is the same girl. This is the same girl. She started off with 315 pounds. And look at where she is. 157. Sometimes people try everything and don't get there. What happens when they don't get there with diet and exercise?
Surgery.
Well, surgery because of issues. What are the issues that drive them to surgery?
Hard.
All of the complications, cardiac, diabetes, hypertension. Usually, it's recommended that you don't have bariatric surgery, which is this types of surgeries, unless your BMI is greater than 40, which is extremely obese or morbid obese. Okay? Or you have serious obesity complications, such as diabetes type 2, OSA, or coronary heart disease. So it's not just because you want to lose 10, 15 pounds. It's because you have serious complications. The types that we talk about mostly are adjustable gastric banding, which has some of the less complications. Gastric bypass, the Roux-en-Y is the most common. And then the biliopancreatic bypass with a duodenal sleeve. And that one is not as common, is more complicated, and it has a higher risk for nutritional deficiencies. Why? Bypassing what? The duodenum, and what comes after the duodenum? Jejunum. The jejunum, which is where a lot of this absorption takes place. Okay? So you're bypassing the duodenum and the jejunum, which is part of your Digestive tract. Which part of your digestive tract?
The small
Small intestine. Small intestine. Review. Esophagus, stomach, small intestine, starting with duodenum, jejunum, ileum, and the large intestine. We're not going to go through a ascending transfer, okay? You guys will study those on your own. But remember, you're building on previous knowledge. This is patho, anatomy, physiology, and health assessment, right? Okay, complications of your surgical treatments. Nutritional deficiencies, especially iron, calcium, B12 vitamins, and all your fat-soluble vitamins. Vomiting, very common. All of it, this person used to eat a lot, and then all of a sudden, just a little amount, right? So that is a common complication of bariatric surgery. The band may slip or break. Peritonitis. What is peritonitis? Inflammation of the peritoneal cavity. Peritoneal cavity. Peritoneal cavity. Life-threatening. Very important. Life-threatening. That inflammation results in an infection. Why does it result in an infection?
It can break.
You have a leakage. So your gastric contents seep into the cavity and cause an infection. Gets absorbed by your bloodstream, and now you get septic. Okay? Abdominal wall hernia, because they went in through there. Wound infections. Remember that the immune system is compromised also with obesity. DVT. What is DVT? Deep vein thrombosis. Why are they at risk? Surgery. Just about any post-op patient is at risk for DVT, so that's why early ambulation is important. What else is important to prevent DVT?
Walking.
Early ambulation. What else?
Prevent DVT?
To prevent DVT.
Oh, they give the heparin and all that.
Heparin. Okay.
And they do the plexipulsers and
There you go. Plexipulses, SCDs, TED hosts. Basic nursing. Don't forget it, because those are the questions you guys miss. I don't want you to miss those questions. Dumping syndrome. I spelled it wrong. Got to get rid of the Y. Dumping syndrome. What is dumping syndrome?
The food process through too fast and it just...
It goes too fast. You have a very small reservoir, very small stomach, right? Or you have a bypass. They bypass it completely. It goes quickly into your small intestine, and so it pulls fluid, and the patient gets nauseous and hypotensive. Hypotensive. Care of the patient with bariatric surgery. I'm just going to go through some quick, important things. Pre-op. You know, they seem so just common sense, but we forget them. We forget them. Number one, note the limitations before surgery, because they're going to have them even more so after surgery. Limitations such as mobility. Are they even walking? A person that weighs 500 pounds is not walking very well. So not only are they at risk mobility-wise, but DVT. Respiratory, right? Respiratory, do they already have sleep apnea? Okay. Cardiac, do they already have cardiac problems? Okay, obtain equipment appropriate for the patient's size. If you have a 500-pound patient going for bariatric surgery, they need bigger wheelchairs. They need bigger beds. Have the scales, the Hoyer lifts, have the equipment. Ensure adequate staffing. Don't try to move these patients by yourself. Trust me, you don't want to end up with back problems, because this is your job. This is your bread and butter. This is your career, okay? Intraoperatively, make sure that if you're an intraoperative nurse, that they take care of positioning the patient and pressure points, okay? Because they can get pressure ulcers, okay? Postoperatively, head of bed. Why do we want the head of bed elevated? Respiratory. What is CPAP?
It's a positive airway pressure.
Very good. C, continuous. Continuous positive airway pressure. A lot of the people with sleep apnea have these machines. They have them at home. If they needed them before surgery, they need them after surgery, okay? Remember to assess right away. You get this patient and PACU. Assess airway, breathing, circulation, okay? Level of consciousness, vital signs, EKG monitoring. You need to know that many of your anesthetic agents are sequestered in fat. So as the patient starts to warm up, it releases them. It is not unusual for these patients to have a degree of anesthetics when they are warming up. So you really need to be monitoring ABCs, level of consciousness, and vital signs in case they start getting drowsy again. Okay? Of course, you already know, assess skin color, peripheral pulses. Remember all this fat here, it impedes vessels. It impedes vessels. Pain, it hurts. Are they on a PCA pump? Blood glucose. Almost all of them, especially with surgery, it's a stressor. It affects blood glucose levels. The wound site, don't forget your wound sites. Are they bleeding? Hemorrhage would be what of your ABCs? Circulation. If this patient was bleeding, what would I expect to see in my vital signs? Low blood pressure accompanied to with increased heart rate, tachycardia. Remember those two. Increased heart rate or tachycardia with low blood pressure, hypotension. Preventative, SCD, okay, turn, cough, debrief. Meticulous wound care. Remember they're at risk for infection. I wanted to point out these pictures. This is an open laparoscopy. An open lap. Okay, this is the laparoscopy. A scope, so that they have only puncture sites because they put in the scope. And this is laparotomy. Otomy, opening, okay? And that's going to make a difference also as to some of the complications after surgery. Your diagnoses for an obese patient: imbalanced nutrition, activity intolerance, ineffective therapeutic regimen, and chronic low self-esteem. The kid says, it's this cool new video game where you play a healthy kid shoveling snow for money. And then look at this. No, that just isn't going to do it, right? Right. It's been a long day. Okay, remember lifestyle change. Now, I didn't go through each of your interventions here, but it is really important that you do go through your interventions. You'd be surprised because those are the ones you miss. What do you get tested on the most? Nursing interventions. Your ability to apply your knowledge into intervening for your patient. So when you are going through these guys, also look at your rationales. Your rationales are very important because you may not get asked that specific intervention, but something related to the rationale for the intervention. Understand, don't memorize, understand your intervention.